Okay, good morning, everybody. My name is Nathan, and I'm a second-year medical student here in Wichita. And we are excited to present our research titled The Characteristics of Attempted and Completed Suicides During the COVID-19 Pandemic. The authors would like to thank everyone involved at the KU Research Forum for the opportunity to present our research. Across the world, almost 1 million individuals die every year from self-inflicted injuries. The numbers are no better in the United States, as in 2019, suicide was the 10th leading cause of death among all ages. Previous studies have characterized the demographics and clinical characteristics of suicide attempts occurring in several countries, including the US. For the link between COVID-19 and suicide, a multitude of suicidogenic risk factors could be attributed to the pandemic. These include things such as social isolation, reduced access to mental health care, and increased economic burden. But in general, in the literature so far, there is no consensus on the impact the pandemic has had on self-harm. What also is unclear is whether injury patterns in suicide attempts have changed from before the pandemic. Therefore, the purpose of our study was to describe the clinical characteristics of patients who underwent a trauma evaluation for attempted or completed suicide during the COVID-19 pandemic. For our methods, we conducted a retrospective chart review from data from our hospital trauma registry and patient medical records. We included patients 18 years or older who presented to our level 1 trauma center in a large Midwestern city after an attempted or completed suicide, and also underwent a trauma evaluation between the dates of March 3rd, 2020 and March 3rd, 2021. We excluded prisoners and patients with mental disabilities. Moving on to the results, we had a total of 30 patients, most of whom were white males with a mean age of approaching 40 years old. Just over half of patients had previously been diagnosed with a mental illness, the most notably of which was substance abuse disorder. Just over a quarter of patients had previously attempted suicide. For our injuries, we had a mean injury severity score of 11.5 and a mean Glasgow Coma scale of 10. About a third of patients presented with a GCS of 3 upon arrival. For mechanisms of injury, the most frequent was the use of a firearm at 36.7% or 11 patients, followed by cutting, piercing, motor vehicle related, and hangings. For toxicology, we completed an alcohol screening for 83% of patients. Over half of these tests were positive with a mean ethanol level of 221. We completed drug screening for a third of patients. Half of these tests were positive, with 3 of the 5 positive tests being positive for more than one drug. The drugs detected included amphetamines, opioids, cannabinoids, and benzodiazepines. For our outcomes, almost 3/4 of patients were admitted to the ICU, and 40% of patients needed mechanical ventilation. The mean length of stay at the hospital was 4 days, and the mortality was 30% or 9 patients. Of those who just survived to discharge, the most common discharge destination was an inpatient mental health facility. Moving on to the discussion, this is one of the first studies of its kind to characterize the characteristics of suicide attempts occurring during the COVID-19 pandemic. Our study suggests a high case fatality rate of 30% among suicide attempts using a traumatic mechanism of injury during the pandemic. Compared to 2019 data at the same hospital, there were 9 more suicide attempts at 39, of which 21% resulted in the death of a patient. On the use of firearms, we suggest that 36.7% of suicide attempts involve the usage of a firearm. Compared to 2019 data at the same hospital, only 12.8% of suicide attempts involved the use of a firearm. This large proportion could suggest an increase in the use of firearms as a mechanism of suicide during the pandemic, but further research would be needed to establish causality between the two. On alcohol use, we demonstrated that over half of the patients that were tested for alcohol were positive. Previous literature has suggested links between both the COVID-19 pandemic and increased alcohol use, as well as between increased alcohol use and increased suicidal behaviors. And like the usage of firearms, there may be a link here, but future research would be needed to establish causality. For our limitations, we had a small sample size, and as a retrospective chart review, our data depends on the accuracy and completeness of the registry and charts. In addition, we had a difficulty of comparing our population to previous literature, as we did not include an internal comparison group, and we did not include non-traumatic mechanisms of suicide, as most studies that have studied suicide before have. In conclusion, we suggest a large proportion of both firearm usage and alcohol usage among those who attempted or completed suicide during the COVID-19 pandemic. There is a need for interventions aimed at preventing suicide and substance abuse during pandemic situations. Thank you, and now I'll take any questions.
Absolutely fantastic. Thank you so much for your presentation, Nate. Let's open it up for questions. If anybody would like to ask a question of Nate.
I will. Nate, good presentation. Thank you. I understand the nature of your study, but I'm interested in your opinion. Even though you can't establish causality, do you think the pandemic was related to this increase in suicide attempts and the kinds of factors associated with them? What do you think?
I'm under the opinion that yes, the pandemic did impact the natures of suicides. And like our data showed, there were actually more suicide attempts in 2019, but the suicide attempts that occurred in 2020 were more serious attempts. The usage of a firearm is a far more serious mechanism of suicide than, say, it would be to use a knife or something like that. And so I'm under the opinion that yes, the increase we saw in the usage of firearms and potentially alcohol during the pandemic was related to factors like I talked about, the social isolation, the reduced access to mental health care, and the economic burden associated with the pandemic.
Thank you so much for that. And thanks for the question, Dr. Coyle. Other questions for Nate? Dr. Hahn, did you have a comment or a question you'd like to make?
Comment. Obviously, I want Nate to run this, but we talked about it. Unfortunately, with the pandemic, going back to Dr. Cleo's question, you can't prove it from our study, but we see the worst of the trauma or traumatic related suicide attempts. And I'm very concerned with the fact that people are picking up handguns and trying to kill themselves by shooting themselves in the head, which isn't a cry for help. That's somebody who's really going to have a pretty good chance of completing the suicide. So the takeaway, which is going to be unpopular, especially in this state, would be we need to reevaluate access to firearms and mental health availability, which I can tell you being on this end of it is still pretty awful. I mean, there's such an overwhelming need for substance abuse, alcohol abuse, and psychiatric interventions that you mix those two together, easy access to firearms and an inability to have a safety net. And we're kind of seeing what we're seeing now, that a lot of people are thinking suicide and successfully completing suicide, even though the absolute numbers dropped from 2019. So this worries me quite a bit.
Nate, any comments you'd like to make about that?
Oh, I think that's spot on. And I think that kind of gets into the implications. And while we're not policymakers, the implications so that something needs to be done, especially during pandemic situations, looking forward to the future, because unfortunately, this probably will not be the last pandemic we ever have on Earth. And so we need to use the lessons we're learning from this study and studies similar to it to say, where did we go wrong and what can we do to help people, that struggle with substance abuse and mental health during these pandemic situations. So I totally agree. And I think that's spot on. And I think it's definitely concerning. Even with our small study and the small sample size we have, we were able to see a difference. And so I think that shows.
Thank you. We have time for one more question. If anyone has a question for Nathan. Okay, thank you so much, Nathan. Really appreciate your
Thank you, everybody.